We will. Thank you,
Boy,
Steve.
yeah, good warning.
Well, after years of reported problems and recalls, the Food and Drug Administration says it's going to take a closer look at how a life-saving device is manufactured. It's a tool that's on standby in more places than you might think, and it has parts that need replacing now and then.
As Craig Smith reports, defibrillators have saved lives right here in the capital region, but now the FDA wants manufacturers to share more data with the government before any newer models are offered for sale.
AEDs do save lives. It's part of the chain of survival. Early defibrillation for a patient who's in a cardiac arrest with a rhythm that can be corrected is invaluable.
That's Dean Romano, director of Rotterdam EMS. He says no one should be alarmed by the FDA's latest focus on past problems with AEDs, automated external defibrillators. As long as the owners have paid attention to recall notices and maintain all the parts, he says there should be no problem.
Businesses that have public access defibrillator programs should have some kind of a service contract with the manufacturer or a company that services these on a regular basis. This way they do a test on the unit, make sure that it's running properly, that it's programmed properly.
According to the FDA, it received 72,000 reports of defibrillator problems between 2005 and last year. Since 2005, there have been more than 100 recalls involving more than 2 million defibrillators.
Connect electrodes.
One thing Romano says must be checked is the age of the pads that attach the electrodes to the chest. They have expiration dates for one important reason.
You can see it's really just a big sticker with aluminum foil on it, and this will dry out. You can see this is open, and it won't stick on a patient's chest properly.
In April of 2012, a defibrillator was credited with helping save a little leaguer whose heart stopped when he was hit by a pitch. Dean Romano says learning to use one is easy.
Everyone who learns CPR also usually learns about AEDs now because there's an AED in a lot of places that you go. All schools have them. Many grocery stores have them. Gyms have them. They're all over the place. They're in police cars. They're in airports, train stations.
That's our Craig Smith with that report. An FDA spokesperson tells us tonight it's important to continue monitoring the device per the manufacturer's instructions and to stay on top of any recall.